The main thing I continue to do is to stay social. I've read that that's probably, and that's what happens to people. There's a stigma attached to Alzheimer's, um, and so people stop socializing, and that's probably the worst thing that you can do is to stop socializing. You have to keep doing the same things you do to keep your brain active.
I use electronics to help me. So I've got a cell phone, and in that cell phone, of course, I've got my family and my friends in there, and I've got a GPS in there, and I've got a camera, and I use electronics to the ultimate. They are my friends.
I know at some point I'm going to forget my children and my grandchildren's names. And that to me is the most devastating thing about this whole Alzheimer's thing. I can live with everything else, but to forget my kids' names and my grandkids. So I spend time, and I have this picture. I actually have it in just about every room in my house. This picture was taken in chronological order from the youngest to the oldest. And so I will say, okay, this is Mackenzie, and Mackenzie's is is Beth and David's daughter. See, and it takes me a while. I should be able to say that without even thinking, but it takes me, and I go down the line until I get to the oldest, who just happens to be me, and I do that for every single face, so that I won't forget them.
There are 5 activities that I very strongly recommend for anybody who believes they have Alzheimer's or has been diagnosed with early stage Alzheimer's. Eating healthy, which for me is not always that easy, but trying best I can to eat healthy. Exercise your brain as much as you can. I have applications on my tablet. I do Jeopardy. I do trivia questions. I've done Sudoku, crossword puzzles, all sorts of things to exercise your brain. Healthy exercise, and I mean sweat. For example, I go use a training bicycle, try and go every day and get healthy exercise. That's number 3. Number 4, get on a program of medication. I take a medication called galantamine, which hopefully has been helpful. And number 5, engage in social interaction. We lived in a house for 35 years out in Lakewood. It became an empty nest. Social interaction was not on the calendar, which is one of the main reasons why we decided to move here. This has really, really helped me as far as activities, meeting people, doing things together. And so for 8.5 years now, I've been rigorously trying to do these types of things to help slow the progress. After 8.5 years, the progress has been relatively slow.
What you have just seen and heard are tips from Washingtonians who were diagnosed early with dementia and continue to live full lives. If you or a loved one are in this situation, remember, you're not alone. There are around 110,000 people in Washington state currently living with dementia. Reach out for more information and support today.